Hello, everybody, and welcome to Meaning-Centered Psychotherapy for Patients with Cancer for Yale New Haven Hospital's 2021 Cancer Survivorship Day. My name is Angela Carralla, and I'm a clinical social worker. I work in the Yale Cancer Center Smilo Cancer Hospital Survivorship Clinic, and I'm here today with my colleague, Brian.
Hello, everyone. I'm Brian Jin. I'm the clinical social worker with Smilo Greenwich and Smilo Trumbull.
And thank you for having us today. So, meaning-centered psychotherapy for patients with cancer. So Brian and I thought it would make sense just to review some background information for those of you who may not be familiar with what meaning-centered psychotherapy is all about. So really, it's about aiming to decrease feelings of sadness and hopelessness by teaching patients how to focus on the importance of creating, experiencing, and keeping a sense of meaning in life. It was developed by Dr. William Breitbart, I think approximately 20 years ago, with his colleagues at Memorial Sloan Kettering, and they created and designed this treatment to be used with cancer patients facing illness. It can be utilized with both individuals as well as in a group setting. It's based on the work of Dr. Viktor Frankl's Man's Search for Meaning. And there's a lot of research to show that meaning-centered psychotherapy is very helpful to those who have cancer, but also for family members and for those who are caring for someone with cancer. So what will you learn? So you'll learn to cope better by finding and creating a sense of meaning and purpose in your life. It's really not uncommon in the cancer survivorship clinic that I meet with patients, and you're not only dealing with the fact that you had cancer, but also the impact that cancer and cancer treatment may even still be having on your life. You'll also learn about different sources of meaning that can be used to help you during your illness. And Brian will be reviewing that with you in just a few moments, as well as learn new ways to face and overcome the challenges that may have been caused by your illness. And it's important to point out that survivorship really begins the day that you're diagnosed. And it's really about living with, through, and beyond your cancer diagnosis and treatment. And really, we can explore meaning and purpose in our life at any point in time. So how does it work? Well, meaning-centered psychotherapy is meant to help patients look for meaning in their past, their present, as well as their future in their everyday life by teaching, answering questions together through homework assignments, as well as discussions with your clinician and group members if you're participating in a group. It helps you to use meaning in your life in order to gain a greater sense of purpose. And meaning-centered psychotherapy is usually done over 7 to 8 sessions. But it may change based on what your needs are, as well as what the clinician thinks might be best for you. There are some forms of meaning-centered psychotherapy that can be done in just a very brief session or over just a couple of days. So what will we talk about? Well, with the curriculum of meaning-centered psychotherapy, we talk about different ways that you can find meaning through why does meaning matter to you? Why is it even important to talk about this? What are the sources of meaning? Who are you? Not just who are you now and today, but who were you before your cancer diagnosis? And who are you now after learning and living through cancer? What is your story? Looking at your past, your present, and your future. What is the attitude that you have? How has that shaped your cancer story and where you're at? How you live your life through creativity, courage, responsibility, and also how you can connect in your life, not only through love and nature, but also humor as well. And what are some of the hopes that you have for your future?
So we're going to talk about Viktor Frankl's basic concept of meaning. And Viktor Frankl was an existential psychiatrist. And what he came forth believing about human existence is that all life has meaning, that we apply the meaning at any given time, that we are the creators and progenitors of meaning, that we as human beings are motivated by this. And that's the will to meaning. That for him, this was the fundamental concept of being human, that we were motivated by our purpose, our values, and our answers to life's difficult questions. And with this capacity, there is the freedom of will, that we always have the chance to choose our response, no matter how dire the situation, how difficult the circumstances, and how little control we might have over those external circumstances. We have the ability to choose internally how we live and how we find purpose and how we respond. Next, please. So the definition of meaning. Well, meaning can be a lot of different things, and it's unique to each person. But what we look for is what pulls us through the difficult times. That when we have purpose, when we have meaning, we can endure anything. We can overcome any obstacle and challenge by having a purpose that we're driven by. And there is a responsibility. There is a responsibility to ourselves, to the people we care about. There is a concept of existential guilt of, are we living the life we're supposed to be living? And this is an intervention that allows us to examine our life. And something like a cancer diagnosis might change how we look at the world and how we feel. And it's an opportunity for change. It's a catalyst for growth. And so this is intervention builds off of that we are the authors of our meaning, and we can find what makes it worth living. Next, please. So there are 4 basic sources of meaning that are defined in this intervention. One is historical, as Angela mentioned. That's the continuum. It's the past, it's the present, and it's what we are giving to the future. It's an alive concept. Sometimes it's referred to as a legacy. Sometimes it's referred to our story. And we have it throughout our stories that we share with other people, like our father's resiliency in a time of struggle, or traditions that our family upholds every Christmas, or Sunday dinners. They're the things that make our life have sort of a coherent narrative and belief throughout it. And it's one of the sources we tap into and we reflect. Attitudinal is a very important one. That's the ability to choose our response, that we can choose how we respond to difficulty, how we respond to obstacles. Whenever we hit something, there is suffering, there's loss, there's difficulty, but we can choose how we now want to live our life and what new purpose we gain from it. There's creative. Creative isn't just painting. It isn't just creating great works of art. It's whatever we invest our life's energy. It can be volunteering. It can be cultivating a garden. It can be our hobbies. It can be playing with our grandchildren. It's very fluid. It's very open. It's whatever makes our heart feel happy, whatever resonates with us. Our creative energy is our energy in the world. Experiential is something we have access to all the time. It's really about being alive and feeling alive. It's about sitting with your best friend and joking and laughing. It's about sitting at the seaside and watching the waves coming and being overwhelmed by the beauty of a sunset and the majesty that's out there. It's about any time and moment where we feel connected and alive. And it's something we have access just by sitting, looking out the window and seeing a plant bloom or flower. Next, please. So how is this helpful for cancer survivors? Angela is going to share a few of her thoughts.
So in meeting patients like you in the Cancer Survivorship Clinic, it's really not uncommon that cancer survivors express to me that they feel lost, that their perspective has changed, that their priorities have changed, that they're really truly wanting to be a part of something bigger than themselves after going through something like cancer and cancer treatment. This curriculum can be utilized again at any point in time throughout your cancer journey. At the beginning, at the middle, in survivorship, or even at the end of life. At any point in time, you can be examining what brings purpose and meaning to your life. Just some examples. I've had patients come to me who've participated in meaning-centered psychotherapy, and they decide that they want to change jobs, that they want a career change because the current job that they're working in isn't bringing them purpose and meaning, and they want to do something else. I've had patients end some negative relationships that they were involved with, and wanting to cultivate more positive relationships as they move forward in the future. Another patient of mine created a lending library at her church. Somebody else went ahead and cataloged all of their family photographs to be able to pass that down to their grandchildren. So again, there's lots of wonderful, inspirational things that come out of somebody participating in this form of psychotherapy. Brian, do you have any experiences to share?
Yeah, I mean, just what you said. I mean, it's beautiful. It's really sort of the unsought gifts of cancer, is that people suddenly find out what is most significant, what is most meaningful, and they live their life accordingly. And it's really empowering, and it feels good. And similar things of a person quitting their job and it being the happiest day of their life, and other people, described it as sort of a rebirth for themselves, and the recognition that maybe they didn't stand up for themselves before, and now they do, because they know how valuable they are, and it's worthwhile. They have the reasons to do it. So it's very unique to each individual, and you get to shape it the way you want to. So we wanted to end with meaningful moments. This is the type of exercise that you do in the intervention. This is really looking at your life and writing down one or two significant moments in your life, something that felt good, something that just comes to mind. It can be something that was really, truly significant, or it could be something very simple. Whatever comes to your heart, write down and jot down and think about what moment that was and why it felt so special to you, and where you felt alive or just connected. And we want you to take this experience and share it with someone you love. Take this moment and give it to them, and just explore it, because this is really those things that we don't really always take time to reflect on and think about, but it's the pure gold that we all have inside. So if you take this moment, and some of the examples is, spending time with your grandkids, or playing catch with a family member, or one group, everyone was talking about trees, and someone mentioned this beautiful red tree, and the whole group went and drove past this red tree, and it was awe-inspiring. And so these are things we can share with each other. And we thank you for this opportunity, and thank you, Angela.
Yes, thank you, Brian. And thank you to all of you who took a few minutes out of your day to listen to us present. And if any of you are interested in learning more about meaning-centered psychotherapy, or would like to speak to any one of us, please feel free to contact myself. Again, my name is Angela Caralla, and I'm through the Yale Cancer Center Survivorship Program at Smilo. And Brian?
I'm Brian Jin, Jin, and I'm in Trumbull and Greenwich.
All right. Thank you so much, everybody. Have a great day. Bye-bye.
Thank you.